When we compare SABRE to surgery, for example, or SBRT to surgery, they're quite different modalities. One of the great advantages of SABRE or SBRT is the fact that it's totally non-invasive. So in those patients who may not want to undergo a surgical procedure, this is quite an attractive approach, particularly when the treatment is quite simple from our perspective. So my institution, SABRE for the kidney involves a single visit for treatment for smaller renal masses, such as the case that we're talking about at EAU. And for larger tumours, this is up to 3 sessions. The patient may come into the department, lie down on a radiotherapy machine for an hour, and go home and have dinner with their family and be very well after that point and be potentially cured of their cancer. That non-invasive approach is a great advantage. The other potential advantage is, particularly when we're talking about partial nephrectomy, which is an ideal way of sparing kidney function, is that SABRE has the capacity to treat perirenal tumours, those tumours that are sitting next to the renal vessels, the arteries, and quite central and endophytic, that may be challenging to perform a partial nephrectomy successfully on. So in the setting of comparing when do we use SABRE and surgery in certain patients, I think generally speaking for SABRE, we tend to reserve these for patients who might have other comorbidities or other medical issues that make them higher risk for either an anaesthetic or for a major operation. Or may have some cardiac issues. For those kind of situations are ideal for a patient who would benefit from a non-invasive and low morbidity treatment. Surgery is better reserved for those patients who are fitter and younger and are able to tolerate the surgery in the first place. And then there is that grey zone where there are patients who may prefer to have one treatment modality or another. And so in some instances, some patients just do not want to undergo surgery, even though they may be medically fit and quite and able to tolerate that treatment. And in these patients, a non-invasive approach such as SBRT or SABRE could be ideal.